Hi, my name is Danielle Smith, and for this assignment, I decided to research adverse childhood experiences and their impact on health. A study conducted in 2020 states that adverse childhood experiences, or ACEs, are described as traumatic experiences such as sexual, emotional, and physical abuse, and adverse family circumstances that occur during adolescence or childhood. 2/3 of the population suffered from at least one before the age of 18, and more than 10% experienced 5 or more. Once experiencing an unfavorable event in a child's life, they become more likely to go through more of these experiences. Due to this, there have been an increasing number of studies researching the impact that ACE have on people's health throughout the course of their lives. It is predicted that the more ACE a child or adolescent experiences, the more physical and mental health issues they will have later in life. Before the first study that researched ACEs and their impact, there was little to no discussion about how children's upbringing affects their life and their health. Most people did not pay attention to how observant kids are and how the things they experience tend to stick with them. Because of this, parents did not censor the behavior around children. The original study that investigated the impact of traumatic experiences was the Kaiser ACE study published in 1998. This study tested the notion that ACEs can have a lasting negative impact on a person's health. A 10-question survey was created, and the scoring was determined by giving 1 point for each of the adverse experiences from 10 topic areas that occurred before a person's 18th birthday. 5 of those questions relate to personal experiences of abuse and neglect, while the other 5 relate to what happened to family members. These questions include topics such as mental illness, substance abuse, incarceration, and parental conflict, and the ACE scores ranged from 0 to 10, 10 being the most amount of ACEs. The idea of the study was that the higher an ACE score a person has, the more likely they are to have physical and mental health issues later in life. The study created the ACE survey that is still used today and is crucial in predicting and preventing issues. ACE and emotional and behavioral problems, or EBP, were examined recently. The study measured socioeconomic positions with a self-reported survey to determine if any status was more vulnerable to ACEs and EBPs. The EBP was measured using a strengths and difficulty questionnaire. Emotional and behavioral problems were each computed on a scale from 0 to 20, with the higher number meaning more problems in the adolescents. The association between ACEs and EBP was assessed using generalized linear models, including age, gender, and the 3 sections of ACE that include no ACEs, 1 to 2 ACE, and 3 or more ACEs. Out of 341 participants, 101 reported no ACE, 178 reported 1 to 2 ACE, and 47 reported 3 or more ACE. The mean for emotional problems was 4.10 for boys and 5.83 for girls. And the mean for behavioral problems was 6.88 for boys and 6.47 for girls. These results indicate that girls are more vulnerable to emotional issues, while boys are more likely to experience behavioral issues. The results also suggest that the more ACE, the more EBP a person will have. A study organized by Whitney stated that people who have an ACE score of 4 or more were 2.4 times more likely to later be diagnosed with hepatitis, 3.9 times more likely to have chronic obstructive pulmonary disease, such as emphysema or chronic bronchitis, and were nearly twice as likely to contract heart disease or cancer. The predictive power of ACEs extends to virtually all areas of adult health, and those with 4 or more ACEs are twice as likely to be smokers, 12 times more likely to have attempted suicide, 7 times more likely to be an alcoholic, and 10 times more likely to have injected street drugs. Although high ACE scores are an indicator of future health issues, some people are resilient and are not destined to have physical and mental health issues. Stable and supportive parents are key in these situations. If a stable and supportive parent figure is not around, the child will be left to deal with their trauma in their own immature manner, which leads to unresolved issues. Because there is no support system, these children are more likely to experience these mental and physical health issues. Occupational therapists have the potential to reduce the number of ACE scores that occur and provide treatment to the children who experience ACEs by working with the children and their parents in regular practice settings. It has been proven that behavior is shaped by ACEs and early life experiences. Deviant behavior can lead to social problems and sometimes even imprisonment. Problematic family environments can lead to antisocial behavior, which makes the person less likely to have empathy and more likely to commit crimes or repeat the actions they had observed. Children who were victims of abuse and neglect are almost twice as likely to be arrested for a violent crime. These children tend to adopt the same abusive practices that they endured, and behaviors such as these cause social issues with the person that they would try and surround themselves with. This is especially true when it comes to going to college. When in college, students face high levels of stress, which can lead to mental health issues. This is the time when most lifelong mental health issues emerge and past traumas that have been ignored come to light, due to 3/4 of many mental health issues arising by the age of 24. When high levels of stress combine with depression and anxiety, people tend to withdraw and keep to themselves. They lose all energy to interact and do the things they once loved. Without proper assistance and social support, it is easy for a person of these circumstances to spiral and cause self-harm or even attempt suicide. When depressed, a social life is almost non-existent. These signs can sometimes be obvious, but they can also be very hard to detect. People in these vulnerable situations need support and reassurance. Throughout the years, there has been rising support for mental health issues, and social support can always be improved and expanded to help more people who have had ACEs, depression, and anxiety. As previously stated, when a child witnesses abuse, they are more likely to be abused or abuse others later in life. Social support is critical in situations similar to these because it was proven in a 2008 to 2013 study that social support and parental monitoring buffered the odds of teen dating violence perpetration. Limitations to this topic would be that there is no control group. It would be unethical to purposely put a child through trauma in order to observe them and how they grow up throughout life. There's no way to truly know the truth about what each child had been through or what ACE they have experienced. Some people may still hide certain childhood experiences out of shame or guilt, and unfortunately, some people may exaggerate their experiences as well. Because most of the data comes from self-reported surveys, it is impossible to be certain the information is accurate. Another limitation is that these studies were not as broad as they could be. To have an accurate representation of this topic, they would have to go to other countries all around the world and compare the data between poverty levels. A participant from Iraq will most likely have a completely different experience than one from America. These studies should be expanded further throughout the world so mental health awareness is made popular in less fortunate areas of the world. Further expansions of support in mental health issues can start with anyone. Anyone can make a difference by stepping up, recognizing the signs, and offering any support they can give. One idea how to battle these issues is to have students screen for ACEs and other mental health issues when enrolling in college. This can help prevent any further damage to the student's mental health and ensure that they succeed in college and have resources available for when they are struggling. Professionals would also have to motivate students to utilize mental health resources and try to figure out some students' reluctance to reach for help. Another idea would be to have children deal with their trauma as it happens. This way, they are more equipped to handle adverse experiences later in life. When children go through a trauma such as losing a parent, witnessing abuse, or getting abused, they should be put in therapy in order to address the trauma before it has the chance to expand. In conclusion, ACE scores are relatively accurate in predicting future mental health and physical health issues. It's helpful and can be used in preventing issues by administering therapy at a young age after a trauma. It could also be used to screen college students in order to assess their mental health and strength. College is already a very stressful time at an age when most mental health issues begin to arise, and this survey can be used to screen which students are more likely to need assistance. ACE scores should be continued to be used and researched. Thank you so much.